There are certain topics in sexual health that people whisper about, search for late at night, but rarely feel comfortable asking out loud. Edging is one of them. Maybe you've heard the term, maybe you're curious, maybe you've tried it yourself and wondered, am I doing something risky here? Well, I'm Dr. Nerea Wolf, urologist and pelvic surgeon. And if you ever face questions or concerns about your urological or sexual health, I want you to know you're in the right place. We're here to help you understand your body with clarity, compassion, and no judgment. Today, we're going to talk openly about edging, what it is, why people do it, what the science says, and most importantly, whether it's safe for you. If this is your first time here, I'd love for you to subscribe and share this channel with anyone who might benefit from honest, medically grounded conversations about sexual wellness. Let's dive in. So what exactly is edging? In simple terms, edging is the practice of bringing yourself, or being brought by a partner, right to the brink of orgasm, and then pausing. Stopping just before climax, letting the intensity settle, and then building it up again. Some people call it orgasm control. Others call it delayed gratification. It can be done alone during masturbation, or with a partner during oral, penetrative, or anal sex. The idea is to ride that wave of arousal multiple times before finally allowing release. Now, edging isn't new. It's been practiced for centuries in various forms, often tied to tantric traditions or mindfulness around pleasure. But in recent years, it's become more mainstream, talked about in podcasts, explored in online communities, and yes, even searched extensively on Google. But here's the thing. Despite how common it is, most people don't really know what it does to the body. They don't know if it's safe. They don't know if it could cause harm, and that's where I come in. As a urologist, I see patients all the time who have questions about sexual function, pleasure, and what's considered normal. And edging comes up more often than you'd think, so let's break it down, starting with why people are drawn to it in the first place. Let's talk about the positives first, because there are reasons people choose to explore this. First, the promise of intensified pleasure. One of the most commonly reported reasons people edge is the belief that delaying orgasm makes the eventual climax more powerful, and there's some logic to that. When you pause just before the point of no return, you're allowing arousal to build even higher. Blood flow increases, muscle tension accumulates. Neurotransmitters like dopamine continue to flood your system. When you finally do allow yourself to orgasm, all that built-up tension is released at once. And for many people, that can feel more intense than a quick, straightforward climax. Is this scientifically proven? Not in large-scale studies, no. But anecdotally, many people report that edging enhances their pleasure. And in sexual health, subjective experience matters. 2. Deepening connection with a partner. If you're practicing edging with a partner, it can become a shared experience of exploration. You're learning each other's bodies. You're communicating about what feels good, what's too much, when to pause, when to continue. Some couples even try to time their orgasms to happen simultaneously, which when it works can feel incredibly intimate. It requires trust, attention, and patience. And those are all things that strengthen connection. Edging can also slow down sex. In a world where we're often rushing through everything, taking time to savor arousal can feel like a gift to yourself and to your partner. Third, learning about your own body. Edging can be a form of self-discovery. When you bring yourself to the edge and then pull back, you start to notice subtle cues. What kind of touch pushes you closer? What breathing pattern keeps you in control? What mental state helps you ride the wave without tipping over? This kind of awareness can translate into better sex overall. You learn what you like. You learn how to communicate that. And you gain more confidence in your own sexual responses. 4. Greater control. Overtiming. For some people, especially those who feel like they climax too quickly, edging offers a way to extend the experience. It's a technique for learning how to manage arousal, how to stay in the pleasure zone longer, and how to delay orgasm when you want to. In fact, this is very similar to a technique we actually prescribe in urology for men dealing with premature ejaculation. We call it the stop-start method. The idea is simple. When you feel yourself approaching climax, you stop all stimulation for about 30 seconds, let the intensity drop, then resume. Sometimes we add what's called a squeeze technique, where you or your partner gently squeezes the head of the penis to further reduce arousal. Over time, this teaches the body to tolerate higher levels of stimulation without immediately ejaculating. And here's the key. It works. There's actually a really interesting study that looked at 36 couples dealing with premature ejaculation. They were split into two groups. One group used the traditional stop-start method. The other group used alternative techniques to delay ejaculation without fully stopping, things like changing rhythm, adjusting breathing, or shifting focus. Both groups were asked to measure their time from penetration to ejaculation using a stopwatch. Before treatment, most were climaxing in under a minute. After practicing these techniques, many were able to extend that time to around 7 minutes. That's a significant improvement. The study also highlighted something important: the way you breathe and move during sex matters. During sexual arousal, your muscles tense up. Your abs, your pelvic floor, your glutes. Your breathing gets faster and shallower. Your thrusting becomes more intense. All of this accelerates the path to orgasm. But if you slow down your breathing, using deep, diaphragmatic breaths from your belly, you can actually reduce muscle tension and prolong arousal. If you focus on extending pleasure at a moderate intensity, rather than racing toward climax, you give yourself more control. The study also emphasized something I think is really important. Don't distract yourself with non-sexual thoughts. Thinking about your grocery list or your work deadline might delay orgasm, but it also disconnects you from the experience, and that defeats the purpose. Edging, when done mindfully, isn't about escaping the moment. It's about fully inhabiting it. Now, as much as edging can offer benefits, it's not without potential downsides. And I think it's important to talk about these openly, because not everything works for everyone. First, blue balls, or epididymal hypertension. This is a real phenomenon. When you're sexually aroused, blood flow increases to the pelvic region, including the testicles. Normally, when you orgasm, that blood flow is released, and everything returns to baseline. But if you edge repeatedly without climaxing, that blood can pool in the area, leading to a dull, achy sensation. It's not dangerous, but it can be uncomfortable. It usually resolves on its own after a while, or with ejaculation. Some people experience this more than others. If you find that edging consistently leaves you with discomfort, it might not be the right practice for you. Second, habituation or idiosyncratic masturbation. If you edge frequently during solo masturbation, especially using a very specific technique, pressure, or rhythm, your body can become conditioned to that exact type of stimulation. This can make it harder to climax with a partner because a hand can apply pressure that a vagina can't replicate. A vibrator can deliver intensity that a penis can't match. Over time, if your body becomes too accustomed to one very specific form of stimulation, you might find yourself struggling to orgasm during partnered sex, and that can lead to frustration, anxiety, and a feeling of disconnection. 3. Delayed ejaculation or difficulty. Climaxing. For some people, edging can backfire. When you repeatedly stop stimulation right before orgasm, you're essentially training your body to hold back. And for certain individuals, that can make it harder to let go when they actually want to. You might find yourself stuck in this prolonged state of arousal, unable to tip over the edge. And instead of pleasure, you start feeling pressure. Pressure to perform, pressure to finish, pressure to satisfy your partner. That kind of mental tension can spiral into performance anxiety, which only makes the problem worse. Fourth, frustration or reduced arousal. Arousal isn't a straight line. It ebbs and flows. When you stop stimulation during edging, your arousal naturally drops. For some people, that's fine. They can build it back up easily. But for others, stopping can break the momentum entirely. They lose the connection to the sensation. The magic fades. And trying to rebuild that peak can feel forced, even frustrating. If you're someone who needs continuous stimulation to stay engaged, edging might not enhance your experience. It might diminish it. So, is edging safe? For most people, yes. It's not inherently dangerous. It doesn't cause long-term physical harm. It won't damage your genitals or ruin your sexual function. But like many things in sexual health, it depends on how you do it and how it makes you feel. Here are a few things to keep in mind. How long should you edge for? There's no universal answer. Some people edge for a few minutes, others go for half an hour or more. What matters is that it feels good and doesn't interfere with your daily life. If you're spending hours edging to the point where it's affecting your work, relationships, or mental health, that's a red flag. Sexual practices should enhance your life, not dominate it. What if you don't ejaculate? Some people worry that if they edge repeatedly and never finish, something will back up in their system. Let me put that concern to rest. Your body will handle it. If you don't ejaculate, your body will either reabsorb the semen or you'll have a nocturnal emission, what most people call a wet dream. This is completely normal and nothing to worry about. What if you're experiencing discomfort? If edging leaves you with persistent pelvic pain, discomfort, or tension that doesn't resolve, it's worth taking a break. Chronic pelvic pain is rare, but it can happen if you're repeatedly engaging in prolonged arousal without release. If symptoms persist, please see a urologist. We can help identify whether something else is going on. What if it's affecting your partnered sex? If you're finding that edging during solo masturbation is making it harder to climax with a partner, consider adjusting your technique. Try to masturbate in ways that more closely mimic partnered sex. Less pressure, more lubrication, varied rhythms. And most importantly, talk to your partner. Let them know what you're exploring. Make sure you're both on the same page. Consent and communication are everything. Here's what I want you to take away from this conversation. Edging is a personal choice. It's not right or wrong. It's not good or bad. It's simply a practice that some people find pleasurable and others don't. If you're curious, try it. Pay attention to how it makes you feel, physically, emotionally, mentally. If it enhances your experience, great. If it doesn't, that's okay too. Sexual wellness isn't about following trends or meeting expectations. It's about understanding your own body, honoring your own desires, and making choices that bring you joy and connection. And if you ever have concerns about edging, about sexual function, about anything related to your urological health, please don't hesitate to reach out to a healthcare provider. We're here to help without judgment. Thank you for being here today. I hope this gave you clarity, reassurance, and maybe even a little confidence to explore what feels right for you. As always, take care of yourself, because you are absolutely worth it.